Hello everybody. So in this video we're going to talk a little bit about sort of the common terminology surrounding many of the most common laboratory tests you're going to see, and some of the logistics on how these labs actually get ordered and how they get presented to you when you look at a page of the results. So you'll notice on this whiteboard here, I've kind of drawn these 7 values, right? And these are the 7 values that make up the basic metabolic panel, right? So if I were to go in the computer in the hospital and you order a basic metabolic panel, then these are the 7 values you're going to get. And now it's important to note that, like, in principle, you can order a lot of these values separately, right? So there's no reason I can't, in principle, order just a serum potassium. But in practice, right, we bundle together many of the most common values into these panels, where the panel is essentially just, it's several related labs that are ordered together and grouped together, right? So this is the basic metabolic panel. This is what we call these 7 values. And it consists of the serum sodium, the serum potassium, the serum chloride, and then this value right here. And I'll talk about that in a second, right? So this I've kind of put 2 labels for. You'll notice it says there's bicarbonate and also CO2. And the reason I put both of those is because this number that you will see is in practice a measure of the serum bicarbonate. However, when you look at the results sheet, it will usually say total CO2. I realize that is confusing. The reason for that is because of how they make this measurement and where they get this number. Just know that when you look at a basic metabolic panel and you see total CO2, what you are effectively looking at is a measure of the serum bicarbonate concentration, right? So we have, next we have the BUN, the blood urea nitrogen, and the serum creatinine. Notice that's creatinine, not creatine, although they are related. They are different. And then lastly, we have the glucose. Okay. Just to briefly cover each of these, right? The serum sodium and the serum potassium, they vary with various different things, and we'll talk about those in separate videos. The serum chloride and the serum bicarb, we tend to mostly look at those when we're evaluating disorders of acid-base. Then the BUN and the creatinine primarily look at in terms of renal function, right? So these 2 things together tell us how the kidneys are working and, what might be wrong if there's a problem with the kidneys. And then the glucose, well, this is pretty much the same glucose that you know and love. The normal range on a venous plasma glucose is going to be slightly lower than the finger stick glucose that you're used to, but other than that, it's basically the same idea. Now, for most patients that you see in the ED, right, or honestly most patients that are in the hospital, you will not just see a basic metabolic panel order. You'll actually see a comprehensive metabolic panel. And the comprehensive metabolic panel includes the BMP, but it also includes these values over here. Okay, so these, the BMP plus the LFTs, as we call that makes the comprehensive metabolic panel. And these we call the LFTs, the liver function tests, because in general, when there is serious liver disease, a lot of these tend to be abnormal, or a lot of these can be abnormal because of liver disease. And this consists of the total calcium, the total protein, the albumin, which is a subset of total protein, AST, ALT, the alkaline phosphatase, and the total bilirubin. It is important for you to know that each and every one of these can be abnormal for things that are not liver disease. And if you're sitting there watching this video thinking, Jen, isn't anything ever straightforward in medicine? the good news is that if you have a patient and a lot of these are really messed up, the first thing you can think about is liver disease, right? And that's why we call them the LFTs. Just know that none of them are exclusive to the liver. We'll talk a little bit more about these things, in more detail and what they mean in a later video. But in general, just know for now, that this over here on the left at the top is the basic metabolic panel, and over on the right we have the LFTs, and the two of them together make up the comprehensive metabolic panel. And this is the sort of set of results you're going to see most typically on patients you take out of the emergency department. So that is metabolic panels in 5 minutes. Let me know if you have any questions.